Give the mute green beret to the rookie. Nurse Denise Carver said it across the trauma station with the practiced lightness of someone pretending a cruel idea was only a joke. 2 residents looked up from their computers. A respiratory therapist smirked. Someone near the medication room whispered that the new nurse would not last 5 minutes. Tessa Monroe stood at the far end of the counter, reading the chart for room 6. It was her 4th shift at Patriot Ridge Military Medical Center. Long enough for the staff to notice she was quiet. Not long enough for anyone to ask why she always checked the location of every airway cart before taking report. Denise slid the chart toward her. Master Sergeant Caleb Rourke. 41. Green beret. Blast injury 3 weeks ago. Surgical airway. Prolonged intubation. No functional voice. He throws the board, refuses care, and grabs anyone who gets near his neck. He grabbed a resident after the resident took away his whiteboard, a younger nurse said. Denise shrugged. Same result. He is still a problem. Across the station, a resident named Evan Cole had his phone angled toward the glass wall of room 6. The camera was open. Dr. Malcolm Reed stepped out of the workroom with a tablet in one hand. He was the trauma director, calm under pressure and impatient with anything he considered already settled. Rourke is waiting for behavioral clearance and transfer to long-term rehabilitation, Reed said. Keep him stable. No unnecessary stimulation. Do not encourage him to fixate on military memories. Tessa looked up from the chart. Why behavioral clearance? Hostility, refusal of examinations, and poor adjustment to permanent aphonia. Who decided the aphonia was permanent? ENT, surgery, and 2 outside consultants. Did his voice disappear immediately after the blast? Reed paused. Denise answered first. He had a tube in his throat. The timeline is not exactly clean. That is not an answer. Reed's expression cooled. According to the notes, he was hoarse after extubation, then deteriorated over several days. He now produces almost no sound. The working diagnosis is bilateral vocal cord dysfunction after trauma and intubation, with a psychological component. Progressive loss of voice is not the same as a voice destroyed at the moment of injury. Denise smiled toward the residents. 4 shifts, and she is already rewriting the case. Tessa closed the chart. I am reading what the case says. Room 6 was bright, crowded, and too loud. Caleb Rourke sat upright on the bed with his shoulders squared and his back away from the pillows. He was broad through the chest, with close-cropped dark hair, a short beard, and bruising that had faded to yellow beneath the right side of his jaw. A healing surgical incision crossed the lower front of his neck. His right wrist was restrained to the bed rail. A whiteboard rested on his lap. A resident stood beside him, reaching for it. Caleb's left hand shot up and locked around the resident's forearm. Security moved forward. Tessa stopped inside the doorway. Nobody touch him. The room froze. Caleb turned his eyes toward her. They were sharp, alert, and furious. Tessa kept both hands visible. My name is Nurse Tessa Monroe. I am standing 6 feet in front of you, slightly to your left. I will not touch you or remove your board without asking. His grip on the resident did not loosen. Denise entered behind her. Sergeant Rourke, this is the new nurse. Let go before security does it for you. Caleb's jaw tightened. The effort to force out a sound produced only a dry breath. Tessa looked at the resident. What happened before he grabbed you? I needed to examine his neck. Did you ask? He cannot answer. He has a board in his lap. The resident glanced at it. He kept writing questions. That is answering. Reed appeared at the doorway. Tessa, de-escalate him. She moved 1 step closer and announced it first. Caleb, I am coming closer. I am not touching you. Release his arm when I tap the bed rail. She raised her left hand. 2 quick taps. A pause. 1 final tap. Caleb stopped breathing. His eyes dropped to her hand. Tessa saw the change but did not understand it. The rhythm had come without thought, an old habit from smoke-filled rooms where voices vanished beneath gunfire and men learned to feel instructions through bone. She repeated it. 2 taps. Pause. 1 tap. Caleb released the resident. Security hesitated. Step outside, Tessa said. Denise frowned. He just assaulted a doctor. He let go the moment someone communicated with him. Reed nodded toward the guards. Outside the open door, the resident backed away, rubbing his forearm. Tessa approached the bed slowly. I need to check your pulse. I will touch your left wrist only. 1 tap on the board means yes. 2 means no. Caleb stared at her hand, then at the curved scar near the base of her left thumb. His face changed from anger to disbelief. He lifted the marker and wrote in large block letters, I know who you are. The room went silent. Denise stepped closer. Is that a threat? Tessa did not look away from Caleb. No. You know him? Reed asked. I have never met him. Caleb erased the words with the side of his hand. The marker trembled between his fingers as he wrote again. Kestrel. Tessa felt the floor shift beneath her. No one had called her that in 8 years. Kestrel belonged to a respirator mask, a dark tunnel and hands slick with blood. It belonged to an army medic who could cut an airway while explosions shook dust from the ceiling. It belonged to the night Tessa had saved one man and believed she had chosen another to die. Caleb watched her face and knew he was right. Before we continue, welcome to Emergency Legends Archive. If you enjoy stories about underestimated heroes, hidden military pasts, and impossible medical cases, subscribe, leave a like, and tell us where you are listening from. Reed stepped into the room. What does Kestrel mean? Tessa kept her voice even. Nothing relevant to his immediate care. Caleb struck the board once with the marker. She looked down. You saved me. Denise folded her arms. You said you never met him. I said I never saw him before. The distinction made Reed study her more carefully. Tessa reached for Caleb's wrist, then stopped. May I? He tapped the board once. Yes. She placed 2 fingers over his pulse. Strong, but faster than it should have been. Under her fingertips, the rhythm carried a faint, irregular vibration that did not belong in the wrist alone. Pain? 1 tap. Where? He pointed beneath the right side of his jaw. Deep or near the skin? He wrote, deep. Does it move? He drew a line from the jaw toward his ear. Do you hear anything with it? He wrote, pulse. In your ear? 1 tap. Tessa looked at his face. The right eyelid sat slightly lower than the left. The right pupil was smaller. She turned toward Reed. Was Horner syndrome documented? The pupil difference was attributed to medication and trauma. Both pupils do not receive different medication. Reed's expression hardened. Continue your assessment. Tessa returned to Caleb. I am going to check your eyes with a light. I will not touch your face. His pupils reacted. The asymmetry remained. Open your mouth. He did. Stick out your tongue. The tongue deviated to the right. Denise looked at Reed. Could be from swelling. 3 weeks later? Tessa asked. She handed Caleb a cup of water with a straw. Small sip only. He swallowed once, coughed weakly, and reached for his throat. The cough carried almost no force. Water escaped from the corner of his mouth. Tessa took the cup away. No more oral fluids. Reed glanced at the chart. He passed a swallow screen yesterday. He is not passing one now. Caleb wrote quickly. Worse today. What is worse? Tessa asked. He pointed to his throat, then his ear, then his left hand. Your hand? 1 tap. Weakness? 1 tap. How long? He held up 3 fingers, then pinched them close together. 3 minutes? 2 taps. 3 seconds? 1 tap. Reed stepped closer. Transient weakness can occur from pain or anxiety. Tessa looked at him. Left hand weakness with right-sided neck pain, pupil asymmetry, and tongue deviation is not something I would call anxiety before ruling out a vascular problem. Denise said, He has had extensive imaging. Then show me the neck vessels. Reed pulled up the initial trauma scan on the wall monitor. No major vascular injury was reported. That was 3 weeks ago. And he has had no stroke. Caleb's marker slipped from his fingers. It struck the floor. His left hand remained open over the board, but the fingers did not close. Tessa took his hand. Caleb, squeeze. Nothing. Look at me. His eyes found her. The left side of his mouth moved normally, but the right side lagged by a fraction. Reed's posture changed. How long has this happened before? Tessa asked. Caleb tried to write with his right hand, but his attention shifted to pain. He pressed his palm beneath the right side of his jaw. Tessa moved closer. I am going to touch the side of your neck. Very gently. 1 tap. She placed her fingertips below the angle of his jaw. The pulse beneath the skin was not simply strong. It churned. A subtle vibration ran under her fingers with every heartbeat, like blood forced through a broken channel. Caleb's eyes locked on hers. His breathing became rougher. Tessa withdrew her hand. Call vascular surgery. CTA of the head and neck. No neck manipulation. No oral intake. Reed looked at the monitor, then at Caleb's recovering fingers. We need evidence before activating a vascular team. Tessa faced him. The evidence is sitting in front of you without a voice. Caleb's left hand finally closed around hers. The strength returned slowly. Tessa looked once more at the swelling beneath his jaw, the smaller pupil, the weak cough and the scar across his throat that had convinced everyone the answer was already known. His silence is getting worse because something inside his neck is growing. Caleb's left-hand strength returned before the vascular team answered the page. The recovery took less than a minute. His fingers closed around Tessa's hand, loosened, then closed again. By the time Malcolm Reed repeated the neurological examination, Caleb could lift both arms and hold them in the air. Reed looked at the monitor. Transient weakness. No persistent deficit. Tessa removed the water cup from the bedside table. Transient does not mean imaginary. It also does not prove a carotid injury. The smaller pupil, drooping eyelid, tongue deviation, pulsatile sound, and abnormal vibration in his neck are not separate coincidences. Denise Carver stood near the doorway, with Caleb's chart pressed against her chest. The joking expression she had worn at the nurse's station was gone. Reed opened the trauma images on the wall monitor. The initial CT showed swelling from the blast, post-operative changes, and no major vascular disruption. That study was performed 3 weeks ago, Tessa said. His voice was still present then. Caleb struck the whiteboard with the marker. Everyone looked at him. He erased the word kestrel and wrote more slowly. First horse, then whisper, then nothing. Tessa read the sentence aloud for the room. When did the hoarseness begin? She asked. Caleb wrote. After tube removed. Did you have any voice at all? Yes. How long? He raised 4 fingers. 4 hours? 2 taps. 4 days? 1 tap. Reed moved closer to the board. The records describe severe dysphonia after extubation. Dysphonia, Tessa said. Not complete aphonia. Caleb continued writing. Voice got weaker each day. Tessa faced Reed. An injury caused during intubation should have been present when the tube came out. Progressive deterioration means something continued to change. Inflammation can progress. So can compression. Reed looked toward the doorway. Where is ENT? As if summoned by the question, Dr. Samira Qureshi entered carrying a flexible laryngoscope case. She was small, composed, and dressed in dark green surgical scrubs beneath a white coat. Her eyes moved from Caleb's neck to the whiteboard, and finally to Tessa's hand inside his. I was told there was a change in swallowing and neurological function, and progressive loss of voice, Tessa said. Samira introduced herself directly to Caleb. I am Dr. Qureshi, the ear, nose, and throat surgeon. I want to place a small flexible camera through your nose to examine your vocal cords. You will remain awake. I will numb the inside of your nose first. Is that acceptable? Caleb looked at Tessa. She touched the board. 1 tap for yes, 2 for no. 1 tap. Samira noticed the communication system. Good. Keep the board where he can reach it. The resident who had tried to remove it lowered his eyes. Tessa stood at Caleb's left side while Samira prepared the scope. Before the anesthetic spray, Tessa placed 2 fingers against his wrist. 2 quick taps. A pause. 1 final tap. Caleb's breathing slowed. Samira looked at the rhythm, then at Tessa. Military? Tessa did not answer. The scope passed through Caleb's right nostril. His eyes watered, but he remained still. Samira watched the image on the portable monitor, while asking him to breathe, swallow, and attempt to produce sound. Only air escaped. The vocal cords appeared on the screen. The left moved weakly toward the center. The right barely moved at all. Samira repeated the command. Try to say the letter E. Caleb's throat tightened. No voice came. Samira withdrew the scope and removed her gloves. The laryngeal structures are relatively intact. There is swelling, but not enough to explain complete silence. The left vocal cord has chronic weakness. The right is almost completely paralyzed. Reed pointed toward the trauma history. Bilateral nerve injury after intubation. Samira shook her head slightly. The left-sided weakness is old. Tessa looked at Caleb. Old from what? He wrote, neck surgery, 6 years ago. What kind? Samira asked. Cervical disc, left side. Voice rough for months. Samira nodded. That explains the chronic left recurrent laryngeal nerve weakness. He compensated because the right cord remained functional. Tessa looked at the monitor showing the nearly motionless right vocal cord. Now something has affected the other side. Yes. Could the blast have damaged the right nerve? It could. Could compression from outside the larynx do the same thing? Samira's eyes moved toward the swelling beneath Caleb's jaw. Yes. Reed folded his arms. The trauma itself remains the most likely explanation. Tessa pointed toward the board. Then why did he speak for 4 days after extubation? No one answered immediately. Caleb wrote another sentence. You saved my airway before. Samira looked at Tessa. Reed did too. Tessa kept her expression controlled. We are discussing his current airway. Caleb erased the sentence and drew 3 vertical marks, 2 close together, 1 separated. The rhythm. Denise stepped nearer. What does that mean? Caleb pointed at Tessa's scar. The curved mark near the base of her left thumb was pale now, almost hidden, unless someone knew exactly where to look. 8 years earlier, broken metal inside a collapsed tunnel had cut through her glove while she opened an emergency airway. She had closed the wound with adhesive strips and returned to work before the bleeding stopped. Caleb had been nearly deaf from the explosion. His eyes had been covered against chemical smoke. He could not have seen her face, but he had felt her hand. Tessa turned the whiteboard face down on his lap. His history can wait. Caleb struck the board against the mattress in protest. No, she said. Your medical care comes first. His eyes narrowed. Do you trust me? He stared at her for several seconds, then tapped once. Yes. Then let me work. Samira examined the outside of his neck. She warned him before each touch, beginning near the surgical scar and moving upward toward the angle of the jaw. Pain here? 2 taps. Here? 1. Samira's fingertips stopped over the same place Tessa had felt the vibration. Her expression changed. There is a brute. Reed moved closer. From the carotid? Possibly transmitted. Tessa said, It feels turbulent. Samira reached for her stethoscope and listened beneath Caleb's right jaw. The sound was not the clean beat of blood moving through a normal vessel. It rushed and churned between heartbeats. How long have you heard the pulsing in your ear? She asked. Caleb wrote, 10 days. Constant? Worse when I turn right. Does the pain increase too? 1 tap. Any headache? He wrote, behind eye. Right side? 1 tap. Tessa looked at Reed. Partial Horner syndrome, lower cranial nerve dysfunction, and pulsatile tinnitus after neck trauma. Samira closed the laryngoscope case. He needs vascular imaging. Reed's resistance weakened, but did not disappear. I will approve an ultrasound first. An ultrasound may not visualize the internal carotid beneath the skull base, Tessa said. It can identify abnormal flow. And if it is negative, we lose more time. Samira intervened. Order both. Duplex now while radiology clears the angiogram. Reed nodded reluctantly. A vascular technician arrived with the ultrasound machine. Caleb remained sitting upright, because lying flat increased the pressure beneath his jaw. Tessa positioned the whiteboard where he could continue communicating. The technician applied gel and moved the probe along the right side of his neck. The first section looked normal. Then the waveform changed. The display filled with chaotic color. Red and blue signals folded into each other beneath the jaw, showing blood moving in conflicting directions. The technician froze the image. That is severe turbulence. Stenosis? Reed asked. I cannot see the full vessel. Something is disturbing the flow higher up. Caleb tapped the board urgently. Tessa leaned closer. He wrote, Can't swallow. Saliva had collected at the corner of his mouth. He tried to clear his throat, but the cough remained weak and breathy. Samira brought suction to the bedside. Do not give him anything orally. Caleb allowed Tessa to hold the suction catheter near his mouth. He followed her instructions without resistance. Denise watched from the doorway. He has refused that from 3 different nurses. They tried to take the board first, Tessa said. Denise looked down at the chart. We thought he was using it to delay care. He was using it to understand what was happening. Caleb wrote with his right hand, while Tessa supported the bottom of the board. They ask questions, then take my answer away. Denise read it. Her face tightened. I am sorry, she said. Caleb stared at her but did not respond. The apology was not enough yet. It was only the first time anyone had admitted that silence did not equal consent. The CT angiography was still waiting for transport clearance when Caleb's pain suddenly intensified. His body stiffened, and his right hand rose beneath his jaw. Tessa placed her fingers on his left wrist. Pain worse? 1 tap. Pulsing louder? 1. Headache? 1. His left hand began trembling. Can you hold the marker? He tried. The marker slipped between his fingers and rolled across the blanket. Samira checked his face. Smile. The left side moved normally. The right side remained nearly even. Tongue. It deviated farther to the right. Reed reached for the stroke phone. Any arm weakness? Tessa placed her palms beneath Caleb's forearms. Lift both. The right arm rose. The left followed more slowly and began to drift downward. Left arm drift, she said. Caleb tried to speak. Only air escaped through his throat. His inability to produce sound made the neurological change appear quieter than it was. Tessa put the marker into his right hand. Write what changed. His letters were uneven. Pulse inside my throat. The final word trailed downward as his left arm weakened further. Samira looked at the swelling beneath his jaw. It was more visible now. Not dramatic. Only a subtle fullness that had not been there 20 minutes earlier. But it moved with each heartbeat. Reed activated the emergency vascular protocol. CTA now. Call Dr. Adrian Cade. Tell radiology we have progressive cranial nerve findings, transient left-sided weakness, and suspected traumatic carotid injury. The transport team entered with a stretcher. Tessa kept 1 hand on Caleb's wrist. 2 taps. Pause. 1 tap. His eyes found hers. The rhythm told him the same thing it had told him in the tunnel 8 years before. She understood that he was still inside the silence, and she was not going to let anyone take his way of answering again. The transport team moved Caleb toward radiology with the whiteboard secured against his chest, and Tessa walking beside his left shoulder. She announced every doorway, turn and change in floor level before the stretcher reached it. No one tried to remove the board. No one touched his neck without warning. For the first time since he entered Patriot Ridge, the entire team treated his silence as communication instead of absence. Straight corridor for 20 feet, Tessa said. Then a left turn into CT. Caleb tapped the board once. Yes, his left arm had recovered most of its strength, but the hand still trembled when he held the marker. The swelling beneath his right jaw remained subtle until the overhead lights crossed it. Then Tessa could see the faint rise and fall beneath the skin. A pulse where no visible pulse should have been. Dr. Samira Qureshi walked on the opposite side of the stretcher. Malcolm Reed followed with the stroke phone pressed against his ear. Dr. Adrian Cade is reviewing the original trauma study, Reed said. He wants the new angiogram performed from the aortic arch through the intracranial circulation. Tessa looked at Caleb. They are scanning the arteries from your chest to your brain, he wrote slowly. Good. The CT room was cold and bright. A technologist approached with contrast tubing and explained the sensation of heat Caleb would feel when the injection began. Caleb watched her hands, then pointed toward Tessa. I will stay where you can see me through the glass, Tessa said. The intercom will remain open. Keep the board beside your right hand. He tapped once. The staff transferred him to the scanner table. As he lowered his head, pain tightened his face. Neck pressure? Tessa asked. 1 tap. Worse lying flat? 1. Samira adjusted the head support. Do not rotate his neck. Keep it neutral. The first images appeared within seconds. The right carotid artery rose normally through the lower neck. Near the angle of the jaw, however, its smooth outline narrowed abruptly, before expanding into an irregular pocket. The radiologist enlarged the image. There is a focal outpouching along the distal internal carotid. Reed leaned toward the monitor. Pseudoaneurysm? Possibly. There is significant motion artifact from swallowing. He can barely swallow, Tessa said. The radiologist changed the reconstruction angle. It could also represent post-operative distortion. He did not have vascular surgery there, Samira replied. A second view loaded. The pocket remained. Inside it, a darker crescent clung to the vessel wall. Tessa pointed toward the screen. Is that thrombus? The radiologist hesitated. Could be incomplete contrast filling. Reed pulled up the original scan from 3 weeks earlier. The same segment appeared smaller then, nearly hidden beneath swelling and streak artifact from surgical material. Samira placed the images side by side. Measure both. The radiologist marked the old study first. 6 millimeters, then the new one. Almost 13. No one spoke for several seconds. It doubled, Tessa said. Within the limitations of the first study, the radiologist answered. The distinction mattered scientifically. It did not make Caleb safer. Reed called Cade again. Traumatic pseudoaneurysm of the right internal carotid, approximately 13 millimeters, mural thrombus, interval enlargement. The radiologist scrolled upward through the intracranial images. Several tiny areas in the right hemisphere received contrast more slowly than the left. Possible distal embolic changes, he said. Order MRI diffusion, Reed replied. Tessa looked through the control room glass. Caleb lay perfectly still beneath the scanner ring, his right hand resting near the board. His eyes remained fixed on the ceiling. He had been telling them something was moving inside his throat for 10 days. The scan had finally begun listening. Dr. Adrian Cade entered radiology before Caleb was removed from the table. He was in his late 40s, lean, deliberate, and already wearing dark blue surgical scrubs beneath a protective vest. He reviewed the images without introduction. Traumatic internal carotid pseudoaneurysm, he said. Likely from blunt or penetrating force at the time of the explosion. There is thrombus inside the sac. Reed joined him at the workstation. Could it explain the voice? Depends on the exact relationship to the nerves. Samira displayed the laryngoscopy findings. Right vagal dysfunction, right hypoglossal involvement, partial Horner syndrome, and progressive dysphagia. Cade rotated the three-dimensional reconstruction. The enlarged artery sat deep beneath the jaw, surrounded by structures controlling speech, swallowing, and tongue movement. It is compressing the lower cranial nerves, he said. Possibly the sympathetic chain as well, Tessa asked. And the left-hand weakness? The clot is on the right. Small pieces can break away and travel into the right side of the brain, so he has already been having transient ischemic attacks. Most likely. Reed looked toward Caleb. He has not had a completed stroke. Cade zoomed farther into the cerebral vessels. Not a large one. The MRI was completed immediately afterward. Caleb remained awake through the scan, communicating by taps whenever Tessa spoke through the intercom. The diffusion images revealed several bright points scattered through the right cerebral hemisphere. Tiny strokes. One near the motor cortex, 2 farther back. Another close to the region controlling sensation in the left hand. Cade studied the pattern. Embolic. Reed's face became still. From the pseudoaneurysm. Yes. The earlier episodes were no longer theoretical. Pieces of clot had already traveled to Caleb's brain. The symptoms disappeared because each obstruction was small or temporary. The next one might not be. Tessa returned to Caleb's side when the scan ended. We found the cause. He picked up the marker. Voice? The artery is enlarged beneath your jaw. It is pressing against nerves that control your vocal cord, tongue, and swallowing. He wrote another word. Strokes? Small ones. Several. Caleb absorbed the answer without visible panic. Then he wrote, Fix it. Cade stood near the foot of the stretcher. We need to repair the artery, but the location is difficult. The pseudoaneurysm is high in the neck, close to the skull base. Open surgery would require extensive exposure and could injure the same nerves already being compressed. Caleb pointed at the angiography monitor. An endovascular procedure is more likely, Cade continued. We enter through an artery in the wrist or groin. We place protection in the vessel to catch clot fragments, remove as much thrombus as possible, and seal the damaged area with a covered stent. Caleb wrote, When? Soon. First, we need to know whether the airway is stable enough for the procedure. Samira approached his right side. I am going to examine the swelling again. He tapped once. Her fingers moved beneath his jaw. The fullness had increased since the bedside examination. Any difficulty breathing? She asked. 2 taps. Pressure? 1. Can you swallow your saliva? Caleb attempted it. The movement was incomplete. A wet sound entered his breathing. Samira reached for suction. Do not force it. Tessa positioned the catheter and cleared the secretions from his mouth. Caleb remained calm until a deeper breath produced a faint, high-pitched sound. Stridor. Barely audible. Samira heard it. So did I, Tessa said. Reed stepped closer. Oxygen saturation is normal. Airway obstruction can progress before the oxygen falls, Samira replied. Cade reviewed the newest neck images. The pseudoaneurysm itself is not large enough to close the airway directly. Not yet, Tessa said. Cade nodded. But if it leaks, expands, or triggers surrounding bleeding, the neck can fill quickly. Caleb took the board. How quickly? Samira answered him directly. If bleeding begins, minutes, possibly less. He looked toward Tessa. She tapped his wrist twice, paused, then tapped once. Not a promise that everything would be fine. A promise that she understood. Reed ordered transfer to the intensive observation unit while the endovascular suite was prepared. Caleb would remain upright, receive antiplatelet medication, and undergo neurological checks every 15 minutes. Denise met them outside the unit carrying a new communication board, several markers and laminated cards marked yes, no, pain, and air. I made copies for the room, she said. Tessa accepted them. Good. Denise looked at Caleb. No one will take your board again. He studied her for a moment, then tapped once. The response was not forgiveness. It was permission to do better. Caleb had been in the monitored room for less than 20 minutes when his breathing changed again. Tessa was documenting his neurological examination when he suddenly sat farther forward and pressed his palm beneath his jaw. Pain increase? 1 tap. Pressure? 1. Breathing? He reached for the board but could not coordinate the marker. His left fingers had weakened again. Tessa placed a laminated card beneath his right hand. Point. He touched AIR. Samira arrived as the monitor alarmed. Caleb's oxygen level remained 96, but every breath now carried a sharper sound. The swelling beneath his jaw was visible without special lighting. Cade entered with the newest reconstruction open on a tablet. The pocket has a narrow neck and an unstable clot. We proceed as soon as the room is ready. Samira listened over Caleb's throat. His airway may not wait for the room. Reed looked at the saturation. He is still oxygenating. Tessa watched Caleb work harder for each breath. His shoulders rose. His weak cough could not clear the secretions collecting above the damaged vocal cords. Cade enlarged the pseudoaneurysm on the tablet. If that pocket expands another few millimeters, his airway may close before the stroke reaches him. The endovascular suite was nearly ready when hospital administration ordered Tessa away from Caleb's bedside. A woman from clinical compliance entered the observation unit with Malcolm Reed and 2 security officers. She introduced herself as Linda Harrow, but her attention remained fixed on the word Caleb had written earlier. Kestrel. We have confirmed that Kestrel was an operational designation, Harrow said. Nurse Monroe did not disclose a prior military connection to this patient. Tessa stood beside Caleb's bed, one hand resting near his communication board. I did not know his name or recognize him when I entered the room, but he recognized you. After I used a communication pattern from my service, that still establishes history between you. History is not a personal relationship. Caleb reached for the marker. His right hand remained steady, but his left lay weakly against the blanket. He wrote in large letters so everyone could read. She stays. Harrow moved closer. Master Sergeant Rourke, this is not a punishment. We need to ensure your medical decisions are not being influenced by an undisclosed emotional connection. Caleb erased the board. No connection. Life debt. Reed looked toward Tessa. What exactly happened between you? That operation remains restricted. Harrow's expression hardened. Then until it is clarified, Nurse Monroe cannot participate in treatment decisions or remain in the procedural area. Caleb struck the board against the bedrail. The sudden movement triggered a sharper sound in his breathing. The swelling beneath his jaw shifted with his pulse. Tessa leaned toward him. Do not strain. He wrote faster. No procedure without her. Dr. Adrian Cade entered while the final word was still visible. We do not have time for a consent dispute. Harrow stepped aside. The patient is refusing unless Nurse Monroe remains. Cade looked at the monitor, then at the visible swelling in Caleb's neck. His pseudoaneurysm is unstable. He has already had multiple embolic strokes. If he delays, the next clot may not be temporary. Caleb pointed at Tessa. Cade understood. She can remain as communication support. She will not make procedural decisions. Harrow shook her head. Not until the conflict is reviewed. Caleb grabbed the consent tablet from the bedside table and pushed it away. His message was unmistakable. No Tessa. No signature. Reed lowered his voice. Caleb, you may lose the ability to make this decision if another stroke occurs. Caleb took the marker again. Then listen, while I can still answer. The word silenced the room. Tessa looked at Harrow. You are removing the only person he trusts because he recognized a skill I used 8 years ago. We do not yet know what else existed 8 years ago. A voice came from the doorway. I do. The man who entered wore an Army service uniform with colonel's insignia and the green beret of Special Forces tucked beneath one arm. He was in his early 50s, tall and broad, with gray beginning at his temples. A sealed file rested beneath his other hand. Colonel Marcus Vale, he said. Special Operations Medical Liaison. Caleb straightened despite the pressure in his throat. Vale approached the bed. Master Sergeant. Caleb raised 2 fingers in a weak salute. Vale returned it. Then he looked at Tessa. Specialist Monroe. She had not heard that rank spoken in years. Colonel. Harrow stepped forward. We are reviewing an undisclosed relationship between Nurse Monroe and the patient. There was no relationship, Vale said. There was an operation. He placed the sealed file on the counter. Operation Glass River. The name changed Tessa's breathing. Caleb watched her face. The tunnel returned before anyone opened the report. Concrete walls beneath an abandoned industrial complex. Chemical smoke rolling through fractured pipes. Emergency lights flashing through dust. Men shouting without realizing no one could hear them. Vale addressed the room. 8 years ago, Tessa Monroe served as an Army combat medic attached to a Special Forces rescue team. Her field designation was Kestrel. Denise Carver stood outside the observation room with several nurses. Her eyes widened. Reed looked at Tessa. You were a combat medic? For 6 years. You listed military medical service on your application. I did. You did not list Special Forces operations. They were not relevant to a civilian nursing position, and most remain classified. Vale opened the file. During Glass River, Master Sergeant Rourke's team entered an underground facility to extract civilian engineers. An explosion damaged the ventilation system and released industrial chemicals into the tunnels. Caleb's hand moved toward the scar low on his throat. The blast temporarily damaged his hearing. Vale continued. He suffered a penetrating injury to the neck and could not communicate normally. Visibility was reduced by smoke. Every surviving member of the medical team wore full respiratory protection. Reed looked between Caleb and Tessa. So he never saw her face? No, Vale said. Caleb took the marker. Mask, goggles, no voice. Vale nodded. Radio communication had failed. Kestrel developed a tactile system for treating casualties who could not hear commands. 2 taps. A pause. 1 tap. Tessa had used the pattern so many times that night it had become part of her hands. 2 taps meant attention. The pause meant wait. The final tap meant follow the instruction that came next. When speech became impossible, Vale said. She traced letters into the patient's palm. Harrow looked at Caleb's earlier message. That is how he recognized her? Partly. Caleb pointed toward Tessa's left hand. Vale looked at the curved scar near her thumb. She cut her hand while creating an emergency airway. Master Sergeant Rourke felt the scar through a torn glove during repeated pulse checks. Tessa remembered Caleb differently from the man before her. Younger, blood across his throat, eyes covered beneath protective goggles, hands striking blindly at anyone who approached because the explosion had stolen his hearing and the chemicals burned every breath. She had seized his wrist. 2 taps. Pause. 1 tap. Then she had traced a single word into his palm. Medic. He stopped fighting, the same way he had stopped when she entered room 6. Reed studied Caleb. 8 years later, you recognize 3 taps and a scar? Caleb wrote. She held my wrist before cutting my throat open. You remember that hand. No one mistook the sentence for aggression. Cade approached the bed. Was the original airway injury related to your current vocal cord weakness? Samira Qureshi answered. Possibly indirectly. His old left-sided weakness came after cervical surgery 2 years later. The Glass River airway likely caused scar tissue, but it is not responsible for the current right nerve compression. Vale closed part of the file. The history explains recognition, not today's pseudo-aneurysm. Harrow still looked uncertain. Why did Nurse Monroe leave the army? Tessa's gaze shifted toward the floor. Vale did not answer immediately. Caleb did. He wrote one name. Carter. The old guilt entered the room before anyone explained it. Vale's voice lowered. Sergeant Ben Carter was another casualty during Glass River. Tessa looked through the observation window toward the bright hospital corridor. But she saw the tunnel instead. 2 men on the ground, both with injuries to the throat, both suffocating. 1 emergency cricothyrotomy kit remaining. Caleb's airway filling with blood. Carter's chest fighting against chemical damage and crushed cartilage. Tessa kneeling between them with seconds to decide where the blade would go. I had 1 complete airway kit, she said. The second medical case was lost behind the collapse. Reed asked carefully, You used it on Caleb? Yes. And Carter? I tried to improvise. Her voice remained controlled, but her fingers had begun rubbing the scar near her thumb. I used suction tubing, part of an IV set, and a cut section of a breathing mask. It was not enough. Caleb's marker moved across the board. You kept him alive longer. Not long enough. Vale looked at Tessa. You saved 5 people in that tunnel. I chose one of 2 men. Caleb struck the board once. No. Tessa faced him. I had the kit in my hands. I placed it in your airway. He erased the board so aggressively that the marker squeaked. Carter chose. Her expression tightened. He could barely move. Caleb pointed at his own palm. The old tactile language. He was hypoxic, Tessa said. He was confused. Caleb shook his head. The effort caused a sudden spasm in his throat. His breathing became wet and strained. Samira stepped forward. Do not turn your neck. Tessa instinctively moved toward him, but Harrow raised a hand. You are still under review. Caleb's pulse rose. The swelling beneath his jaw visibly expanded with each heartbeat. Cade looked at Harrow. Your review is now interfering with stabilization. Harrow hesitated. Vale closed the distance between them. There was no romantic relationship, no private contact, and no meeting after the operation. Kestrel treated him once under combat conditions. Removing her serves no clinical or ethical purpose. Cade added, Her communication method lowers his blood pressure and allows us to monitor neurological changes in a patient who cannot speak. I want her in the procedure. Samira nodded. So do I. Reed looked at Harrow. I am authorizing her presence as communication support. Harrow saw the room had already decided. She does not provide independent consent or direct the procedure. Agreed, Tessa said. Caleb tapped the board once. Yes. The tension in his shoulders eased by a fraction. Cade opened the consent form. We will use an endovascular approach. A protection device will be placed beyond the pseudoaneurysm to catch debris. We will remove the unstable clot and seal the injured artery with a covered stent. Because your airway is already narrowing, Dr. Qureshi will remain prepared for emergency surgical access. Caleb listened. Risks include major stroke, rupture of the carotid artery, severe bleeding, permanent nerve injury, loss of airway, and death. Caleb wrote, Chance without it? Cade answered directly. Poor. The artery is enlarging and you have already sent clots into your brain. Caleb tapped once. Proceed. Tessa placed the consent tablet beneath his right hand and indicated the signature field. He signed slowly. Vale remained near the doorway, while the team prepared transport. Tessa leaned closer to Caleb. What did Carter choose? He looked at her. She had asked the question quietly, but everyone heard it. Caleb's expression changed. The anger left first, then the military control. What remained was the memory of a man lying beside him in the smoke. He lifted the marker. His hand trembled from pain and fatigue, but the words were clear. Carter chose me. You never knew. The marker remained suspended above the whiteboard, while Tessa stared at the sentence Caleb had written. Carter chose me. You never knew. For 8 years, she had remembered the tunnel as a room with only one decision left inside it. 2 soldiers were dying. 1 complete airway kit remained. Her hands had gone to Caleb because his obstruction was visible, because his pulse was stronger, because some part of her training had calculated survival before the rest of her could object. She had believed that calculation belonged to her. Caleb pointed toward his open palm. Tessa understood the request. You want me to use the old system? He tapped once. Yes. She took his right hand and turned it palm upward. The skin was rougher now, marked by years of training and operations she knew nothing about. 8 years earlier, that same hand had been covered in dust, chemical residue, and another man's blood. Tessa traced the first letter slowly. C. Then another. A. Caleb closed his fingers around hers before she could continue. He shook his head and took back the marker. I remember everything. The observation room disappeared around her. Glass River had begun with an extraction order that sounded simple on paper. A team of civilian engineers had been trapped beneath an abandoned processing complex after an armed group damaged the underground ventilation system. Caleb's Special Forces unit entered through a service tunnel with Tessa attached as the senior medic. The first explosion cut the team in half. The second took the lights. Chemical smoke moved through the corridor, while emergency alarms flashed red against concrete walls. Radio channels collapsed into static. Men shouted without hearing their own voices. Tessa had pulled a respirator over her face and crawled toward the nearest heat signature. Caleb lay beneath a section of broken ductwork. A metal fragment had entered the right side of his neck. Blood bubbled around the wound each time he tried to breathe. His protective goggles were clouded, and the blast had left him unable to hear. He struck at the first hands that reached him. Tessa caught his wrist. 2 taps. Pause. 1 tap. Then she traced a word into his palm. Medic. His body stopped fighting. She packed the wound, restored airflow, and dragged him toward a section of tunnel where the smoke was thinner. That was where she found Sergeant Ben Carter. Carter was conscious, but barely. A collapsed support beam had struck his chest and lower neck. Every breath produced a high, wet sound. His airway was closing from the inside. Tessa opened her medical pack. 1 cricothyrotomy kit remained. The second pack had disappeared behind the collapse. She looked from Caleb to Carter and understood that neither man had enough time for hesitation. Caleb's wound was bleeding into his airway. Carter's throat was swelling shut. Both required surgical access. 1 complete kit could save one of them. Tessa reached toward Carter first. His hand struck her wrist. She thought it was a spasm. He pushed again, directing the kit away from himself. No, she had shouted, forgetting that he could barely hear her. Carter turned his head toward Caleb, then toward the tunnel where 3 wounded men waited for direction. Caleb knew the extraction route. Carter knew it too. Without Caleb, the remaining team might never reach the surface. Tessa believed Carter was confused from oxygen loss. She moved the kit back toward him. He grabbed Caleb's hand and opened the palm. With 1 shaking finger, Carter traced letters against the skin. Tessa could not see the message from where she knelt. She only saw Caleb's face change. Then Caleb reached toward the airway kit and pushed it back into her hands. Tessa used it on him. She cut through the membrane below his damaged larynx, while his blood covered her gloves. Broken metal sliced the base of her thumb, but she did not stop. When the tube entered and Caleb's chest finally rose, she turned to Carter with pieces of suction tubing, a shortened IV connector, and part of a breathing mask. She built a second airway from equipment never designed to become one. It worked for 4 minutes, then 3 more. Long enough for Carter to help the wounded team identify the route. Not long enough to save him. In the hospital room, Tessa looked down at Caleb's palm. What did he write? Caleb lifted the marker. Get them out. The sentence was smaller than the one before it. Tessa's breath caught. He was conscious? Caleb tapped once. He understood there was only one kit? One tap. He knew you were the only one who could guide the others. One tap. Tessa sat in the chair beside the bed because her knees no longer trusted her. I thought he was hypoxic. I thought he was pushing me away because he did not understand. Caleb erased the board. He understood. I chose you. He shook his head. He chose the team. The distinction entered slowly. Carter had not selected Caleb because one life mattered more than another. He had selected the route, the wounded men behind them, and the only operator who could lead everyone through the smoke. Tessa had not decided which man deserved to live. Carter had used the last decision available to him. Colonel Marcus Vale stood near the doorway, silent until Caleb finished writing. The after-action report said Carter remained conscious long enough to direct the team toward the east maintenance shaft. Vale said. It did not explain how. Caleb looked at him and wrote, He used my hand. Vale's expression tightened. You never reported the message. Caleb erased the sentence. Classified debrief asked for routes, not last words. Tessa looked at Vale. And no one asked me what I believed happened. You requested separation before the review was complete. I left because I thought every man who saw me would remember that I chose wrong. Caleb tapped the board sharply. No. Tessa faced him. He wrote, We remember you got us out. The monitor alarmed before she could answer. Caleb's pulse climbed past 130. His right hand moved beneath his jaw, pressing against the swelling. The high sound in his breathing returned, louder than before. Tessa stood immediately. Pressure increasing? One tap. Can you swallow? He tried. Nothing moved. Saliva collected at the corner of his mouth. Samira Qureshi entered with suction equipment, while Adrian Cade followed carrying a tablet. Malcolm Reed moved to the opposite side of the bed and began another neurological examination. Lift both arms, Reed said. Caleb raised the right. The left drifted almost immediately. New weakness, Tessa said. Cade displayed the latest vascular images. The pseudoaneurysm has enlarged again. There is more clot along the inner wall. Samira touched the swelling only after warning Caleb. The airway space is narrower. We cannot delay. Caleb pointed toward the board. Tessa placed it beneath his right hand. How long? Cade answered directly. The endovascular room is ready now. Caleb wrote, Plan. We enter through the femoral artery, Cade said. A filter will be positioned beyond the damaged area to catch clot fragments before they reach the brain. We will remove the unstable thrombus and place a covered stent across the pseudoaneurysm. Caleb pointed toward his throat. Samira continued, Your airway is already compromised. We will attempt controlled intubation with a small flexible scope. If the swelling prevents the tube from passing, I will create a surgical airway below the obstruction. Caleb's eyes moved to Tessa. The old scar low on his neck had begun with her blade. The new one might begin with Samira's. Tessa placed 2 fingers against his wrist. 2 taps. Pause. 1 tap. Cade continued. The procedure could dislodge the clot and cause a major stroke. The artery could rupture. The bleeding could expand into your neck. The stent may block a branch vessel. There is also a chance the nerve damage will remain even after the pressure is relieved. Caleb wrote, Voice? Samira answered. Repairing the artery may allow the right nerve to recover, but the left cord was already weak. You may never regain the voice you had before. He looked at the board for several seconds. Then wrote, Living first. Voice later. Cade nodded. That is the correct priority. Caleb signed the final consent with his right hand. The left remained weak against the blanket. As the team prepared transport, the swelling became more visible. It rose beneath the right side of his jaw and spread lower along the neck. His breathing grew harsher with every movement. Samira placed a hand near the tracheostomy kit. We move now. The stretcher rolled toward the procedure suite. Tessa walked beside Caleb, keeping the board against his chest so he could still reach it. He wrote one final message before the doors opened. Did Carter blame you? Tessa stared at the question. I do not know. Caleb erased it. He didn't. You cannot know what he felt. Caleb turned his palm upward. He told you? 1 tap. Tessa placed her fingers over his hand. What exactly did he write? Caleb took the marker one last time. Save who you can. Carry no one who chose to stay. Tessa read the words twice. The first part sounded like a medic's duty. The second sounded like permission she had refused for 8 years. The procedure doors opened. Inside, the endovascular team waited beneath bright white lights. A covered stent rested inside sterile packaging. The airway cart stood open beside Samira. Blood products had been prepared in case the artery ruptured. Caleb transferred onto the table while Tessa announced every hand that touched him. When he was positioned, Samira examined his neck again. The skin had tightened over the swelling. She looked at Cade, then at Tessa. If the swelling starts during the procedure, we may have seconds to open his airway. The endovascular suite held 2 emergencies before the procedure even began. One was hidden inside Caleb Rourke's right carotid artery, an unstable clot attached to the wall of an expanding pseudoaneurysm, close enough to the brain to cause a devastating stroke within seconds. The other was visible beneath the skin of his neck. The swelling below his right jaw had spread downward, narrowing the passage through which he still managed to breathe. Dr. Adrian Cade stood beside the angiography monitors, while Dr. Samira Qureshi prepared the airway equipment. A flexible scope, several sizes of breathing tube, and a surgical tracheostomy tray rested open on the same cart. Tessa remained near Caleb's left shoulder. You are lying beneath the imaging equipment, she told him. Dr. Cade will enter through the artery in your groin. Dr. Qureshi is beside your head. I am on your left. Caleb lifted his right hand. Tessa placed the whiteboard beneath it. Awake? For the beginning? Samira answered. We need enough sedation to keep you comfortable, but we want you responsive while we assess the airway and monitor your brain. Caleb wrote another word. Board? It stays with you until we need your arm still, Tessa said. After that, we use taps. She touched his wrist. 2 quick taps. A pause. 1 final tap. His breathing slowed slightly. Cade approached the table. Master Sergeant, I am cleaning the right side of your groin now. You will feel pressure but should not feel sharp pain. Tell Tessa immediately if anything changes in your vision, strength, sensation, or breathing. Caleb gave 1 tap against the board. Yes. The local anesthetic entered beneath the skin. Caleb's jaw tightened, but he remained still. Cade placed the arterial sheath and advanced the first catheter toward the right carotid artery. On the monitor, the vessel appeared as a bright pathway rising through the neck. Then the contrast reached the damaged segment. The pseudoaneurysm filled like an irregular chamber beside the artery. Blood swirled inside it. A dark mass clung to one wall. The thrombus is larger than it appeared on CT, Cade said. Reed watched from the control area. How unstable? Cade injected another small amount of contrast. The clot shifted with the pulse. Very. Tessa kept her hand beneath Caleb's left fingers. Can you feel both hands? 1 tap. Any weakness? 2 taps. No. Pressure in the neck? 1 tap. Worse than before? 1 tap. Samira watched the airway monitor. Caleb's oxygen level remained normal, but the sound of each breath had grown harsher. Cade guided a thin wire toward the carotid artery. I need to place the cerebral protection filter beyond the pseudoaneurysm before touching the clot. The wire approached a tight curve beneath the skull base, then stopped. The angle is sharper than the reconstruction showed. Can you cross it? Reed asked. Not safely from this position. Cade withdrew by a few millimeters, rotated the catheter, and tried again. The wire entered the curve but pressed toward the outer wall. He stopped immediately. If I force it, I may extend the injury or rupture the pseudoaneurysm. Caleb's left hand squeezed Tessa's fingers. Pain? She asked. 1 tap. Neck? 1. Head? 2. The pain remained beneath the jaw. Tessa looked at the swelling. It had not visibly changed, but the skin appeared tighter. Cade selected a differently shaped catheter. I am changing the approach. It will take a few minutes. Caleb reached for the board. His handwriting was less controlled than before. "How many?" "3 or 4, if the vessel cooperates," Cade said. Caleb erased the question. "It won't." No one in the room smiled. Tessa touched his wrist with the old rhythm. 2 taps. Pause. 1. "Stay with what you can control," she said. "My hand. Your breathing. 1 answer at a time." Cade advanced the new catheter. This time, the wire followed the inside edge of the curve and passed beyond the pseudoaneurysm. Across. A small filter opened in the artery above the damaged segment. Cerebral protection deployed. For the first time since the procedure began, Cade had something between the unstable clot and Caleb's brain. He introduced an aspiration catheter and guided it toward the pseudoaneurysm. Tessa tested Caleb again. "Lift your left thumb." It moved. Left index finger. It moved more slowly. "Right hand?" Caleb lifted it from the board. "Good." The aspiration catheter entered the expanded pocket. Dark material appeared in the tubing. "Removing thrombus," Cade said. Blood flow through the main artery improved slightly. Then Caleb's left fingers weakened against Tessa's hand. Caleb squeeze. A faint response. Again. Weaker. Tessa looked toward Cade. His left hand is losing strength. Cade stopped aspiration and injected contrast. The protection filter had captured several small fragments. No large embolus beyond the filter. Reed entered the suite far enough to see the neurological monitor. Could reduced flow during aspiration explain it? Possibly, Cade said. Or a fragment reached a smaller branch before the filter opened. Tessa leaned closer to Caleb. "Can you move your left arm?" He tried. The hand lifted only an inch before falling back. "Right arm?" "Normal." "Face?" Samira asked him to smile. The left side moved less than the right. "New neurological deficit," she said. Cade resumed with greater caution. "We finish removing the source, or he continues throwing clots." Caleb's right hand found the marker. "Continue." Cade nodded. The second aspiration removed most of the remaining thrombus. The contrast image showed cleaner flow through the carotid artery, but the pseudoaneurysm remained open. Preparing the covered stent, a nurse opened the device. The stent advanced toward the injured segment, while Caleb's breathing became louder. He lifted his right hand toward his neck. Tessa intercepted it gently. "Do not press on the swelling." "Pressure worse?" 1 tap. "Air harder to move?" 1. Samira examined the mouth and throat with the flexible scope. The right side of the airway had narrowed further. Tissue around the larynx shifted inward with each breath. "We need to secure the airway now," she said. Cade looked at the stent position. "I am 30 seconds from deployment. You may not have 30 seconds after the swelling starts." Caleb wrote quickly. "Finish artery." Samira read the message. "If the airway closes, finishing the artery will not matter." Tessa placed both hands around Caleb's right hand. "Listen to me. Dr. Qureshi needs to put in a breathing tube before the swelling becomes worse." He wrote, "Awake? You will be sedated." His eyes fixed on Tessa. The fear was not of unconsciousness. It was of losing the only remaining way to speak. Tessa understood. "I will keep contact with your hand until the medication takes effect. When you wake, the board will be there." Caleb hesitated, then gave 1 tap. "Yes." The anesthesiologist increased the medication. Samira guided the flexible scope through Caleb's mouth while he remained partly conscious. "The opening is narrow," she said. Advancing the tube. The tube reached the swollen area and stopped. Samira changed the angle. It would not pass. Smaller tube. A narrower one was prepared. Caleb's oxygen level dropped from 98 to 94. Tessa kept tapping the rhythm against his wrist. 2 taps. Pause. 1. His right fingers answered weakly. Samira tried again. The second tube reached the same obstruction. The airway is collapsing around it. Cade looked at the live carotid image. The pseudoaneurysm is changing. Contrast appeared outside the neat outline of the damaged pocket. A thin line. Then another. "Leak," he said. Blood was escaping around the artery into the surrounding tissues. The swelling beneath Caleb's jaw expanded visibly. His oxygen level fell to 90. Samira withdrew the tube. "Surgical airway now." The room accelerated. A nurse opened the tracheostomy instruments, while the anesthesiologist provided oxygen through a mask. Cade held the catheter perfectly still inside the carotid artery. If I move before sealing the leak, he may bleed faster. If I do not open the airway, he suffocates, Samira replied. Tessa remained beside Caleb's left hand. He was sedated but not fully unconscious. His eyes opened slightly, searching without focus. She tapped his wrist. 2. Pause. 1. His fingers answered. 2. Pause. 1. The pattern passed between them like a pulse. Samira cleaned the lower neck beneath the old surgical scar. Tessa, tell him. Tessa leaned close. The swelling is blocking the normal airway. Dr. Qureshi is opening a new passage below it. You will feel pressure. The medication will reduce the pain. I am still holding your hand. Caleb's fingers moved once. Samira made the incision. Blood appeared immediately, but not from the carotid. She separated the tissues and reached the trachea while the oxygen level fell to 86. Opening. The tracheal wall parted. Samira inserted the tube. The anesthesiologist connected ventilation. Caleb's chest rose. Air entered cleanly beneath the obstruction. Oxygen climbed. 88. 92. 96. The airway is secure, Samira said. Cade deployed the covered stent across the damaged carotid segment. The mesh expanded, sealing the opening of the pseudoaneurysm against the arterial wall. He injected contrast. Blood continued to enter around the upper edge. Proximal seal is good. Distal edge still leaking. He expanded a small balloon inside the stent. The vessel wall pressed outward. The leak slowed, then stopped. Pseudoaneurysm excluded. The room had saved the airway and sealed the artery within less than 2 minutes. But the danger was not finished. Cade began withdrawing the aspiration catheter and protection filter. The filter held several fragments of clot. As it passed the upper curve, one fragment escaped from the edge. It traveled upward through the internal carotid artery. Embolus, Cade said. The fragment entered a branch leading toward the right side of Caleb's brain. Prepare thrombectomy catheter. Tessa tested his hand. Caleb, squeeze. His right hand answered. The left did not. Move your left index finger. Nothing. Move your left thumb. No response. Samira checked his face. The left side had fallen. Cade advanced a smaller catheter toward the escaping clot. Tessa pressed her fingers into Caleb's palm and repeated the old signal. 2 taps. Pause. 1 tap. There was no answer. She tried again. 2 taps. Pause. 1. Caleb's hand remained still inside hers. The escaped clot moved through Caleb Rourke's right internal carotid artery and lodged in a branch supplying the motor regions of his brain. On the angiography monitor, blood flow stopped beyond the obstruction. Dr. Adrian Cade changed catheters without looking away from the screen. Right middle cerebral branch. Partial occlusion, but it is tightening. Caleb lay beneath the sterile drapes with a surgical airway breathing for him. The covered stent had sealed the leaking pseudoaneurysm in his neck, but the left side of his body no longer responded. Tessa held his left hand. It was warm, motionless. She repeated the old signal against his palm. 2 taps. A pause. 1 tap. Nothing answered. Samira Qureshi checked Caleb's pupils. Both reacted to light. His right hand still moved weakly, but the sedation, the tracheostomy, and the new neurological deficit had taken away every communication system they had used. He could not speak. He could not write. He could not move the hand Tessa was holding. Could he be unconscious? Malcolm Reed asked from the control area. Possibly, Samira said. Or conscious and unable to respond on the left. Cade advanced the thrombectomy catheter toward the blocked branch. I need several minutes. Tessa looked at Caleb's face. His eyes were partly open, but they did not track her. The left corner of his mouth had fallen. The ventilator lifted his chest in controlled breaths. For 8 years, she had remembered him as the man who could not hear her in a smoke-filled tunnel. Now he could hear, but his body had become the sealed room. Tessa moved to his right side. Caleb, I am changing hands. I am placing your right hand in mine. His fingers remained loose. Move your right thumb. Nothing. Index finger. No response. Reed looked at the medication levels. The sedation may be deeper than we intended. The anesthesiologist reduced the infusion slightly. Enough to explain delayed response. Not enough to explain complete loss. Cade reached the base of the blocked vessel. I can see the clot. Tessa turned Caleb's right palm upward. Words spoken into the room might not be enough. His brain had survived blast pressure, lack of oxygen, and years of combat by learning to use whatever pathway remained available. She traced one letter into his palm. H, then another. E. R. E. She paused and drew a question mark. Here? Caleb, move one finger if you understand. For several seconds, nothing happened. Then his right index finger lifted less than an inch. Tessa stopped breathing. Samira saw it. Repeat the command. Tessa traced the same word again. H-E-R. E? The index finger moved. Small, slow, intentional. He is conscious, Tessa said. Reed stepped closer to the glass. Can he understand language? Tessa traced another word. Pain? Move one finger for yes, two for no. Caleb raised one finger. Yes, Tessa said. Where? Samira asked. Tessa traced letters again. H-E-A-D? One finger. N-E-C-K? Two fingers rose with difficulty. No. The surgical airway and sealed artery were holding. The danger had moved into his brain. Cade advanced a microwire beyond the clot. Crossing now. The wire passed through the narrow remaining channel. Preparing retriever. Tessa kept Caleb connected to the room. She traced C-L-O-T, then B-R-A-I-N, then R-E-M-O-V-I-N-G. His index finger moved once. He understood. The miniature retrieval device opened beyond the obstruction. Cade allowed the mesh to expand through the clot while aspiration began from below. Device deployed, waiting for engagement. Caleb's blood pressure dropped. The anesthesiologist increased support. Systolic 88. Keep it above 110, Cade said. He needs collateral flow. Medication entered the IV. The pressure climbed slowly. Tessa felt Caleb's index finger press against her palm. She traced S-T-A-Y. He pressed again. I am staying. The words were simple, but they belonged to more than the procedure. She had left the army believing every survivor of Glass River would remember her as the medic who selected one man over another. Caleb had spent 8 years remembering the opposite. He remembered the hand that warned him before pain, the taps that replaced sound, the person who remained beside him when his airway disappeared. Cade began withdrawing the retriever. Clot engaged. The device moved several millimeters, then stopped. Resistance. Vasospasm? Reed asked. The vessel tightened around the device. Cade delivered medication through the catheter. The branch widened slightly. Again. The retriever moved. The clot came with it, stretched inside the mesh. Halfway back, part of the obstruction began slipping through the device. Cade increased aspiration. Hold pressure. The fragment twisted at the branch point. If it escaped, it could divide into vessels too small to reach. Tessa traced a sentence into Caleb's palm. F-O-L-L-O-W-M-Y-H-A-N-D. His index finger moved. She began the rhythm. 2 taps. Pause. 1 tap. His finger repeated the final tap. Cade rotated the retriever by a fraction and pulled again. The clot entered the aspiration catheter. Removed. Contrast filled the branch. At first, only a thin line of blood passed through. Then the vessel opened. Flow returned across the right cerebral hemisphere. Cade watched through a second injection. Complete reperfusion. No one celebrated yet. Tessa traced M-O-V-E-L-E-F-T-F-I-N-G-E-R. Nothing happened. Samira checked Caleb's arm. Still flaccid. Flow has been restored, Cade said. Recovery may take time. Or the tissue is already injured, Reed replied. Tessa heard the sentence but refused to let it become a verdict. She returned to Caleb's left hand and placed her thumb beneath his index finger. Caleb, blood is moving again. You do not need strength. Give me pressure. Nothing. She tapped his wrist. 2. Pause. 1. Answer with anything. A minute passed. The monitors continued. The ventilator continued. Cade inspected the carotid stent and confirmed that no blood entered the pseudo-aneurysm. "The repair is stable," he said. "No further leak. No new clot." Tessa focused only on the hand. "Caleb, remember Glass River. You could not hear me, but you knew where my hand was. Find it again." His left index finger trembled. Not enough to lift. Enough to press into her skin. Samira leaned closer. "I saw that." Tessa repositioned her thumb. Again. The pressure returned. Weak, but real. "The pathway is intact," Samira said. Caleb's eyelids moved. His eyes shifted toward Tessa's voice. She traced one final word into his palm. "SAFE." His finger answered once. The procedure ended with the covered stent fully open, the pseudoaneurysm excluded, and the cerebral vessel restored. Caleb was transferred to the neurological intensive care unit with the tracheostomy still in place. The left side of his body remained weak. The first MRI showed several new areas of restricted blood flow, but no massive completed stroke. Doctors could not yet predict how much strength would return. Tessa placed the whiteboard on the table beside his bed, even though he could not use it. No one removed it. Hours later, the sedation was reduced. Caleb opened his eyes and turned toward her voice. The tracheostomy prevented sound. His right hand moved first, lifting slowly from the blanket. Tessa placed the marker between his fingers. His grip failed. The marker fell. For a moment, frustration changed his face into the expression everyone had once called aggression. Tessa picked up the marker, but did not force it back into his hand. "We can use the palm." She traced. "TIRED?" One movement of his right index finger. "Yes. PAIN? 1. Medication is coming." She traced another question. "REMEMBER?" Caleb raised one finger. He remembered the procedure. He remembered losing the left side. He remembered her hand. The next morning, his left thumb moved. By afternoon, he could bend 2 fingers. The recovery was incomplete and exhausting, but each return proved that the clot had not taken everything. Malcolm Reed entered the ICU after rounds. He stood where Caleb could see him, and waited until Tessa placed the board within reach. "Master Sergeant, I owe you an explanation." Caleb looked at him without expression. Reed continued. "We treated the loss of your voice as a final consequence of trauma. When you resisted care, we treated that as evidence of psychological refusal, instead of asking whether your symptoms were changing." Caleb's right hand was strong enough to write one word. "Why?" "Because the first explanation was convenient," Reed said. "The scar was visible. The intubation was documented. The behavioral notes were repeated. Every new clinician inherited a conclusion instead of examining the progression." Caleb wrote, "You saw silence. Decided nothing was being said." Reed read the sentence twice. "Yes." Denise Carver came later without a chart or supervisor beside her. She announced herself from the doorway. "Master Sergeant Rourke, it is Nurse Carver. May I enter?" Caleb tapped the board once. She approached but did not touch the bed. "I gave your assignment to Tessa as a joke. I expected you to make her uncomfortable. I used a patient who could not speak as a test for a new employee." Caleb wrote slowly. "I was having strokes. I know. You called me a problem." "Yes." Denise's voice weakened. "You were trying to protect the only way you had to communicate, and we documented it as aggression." Caleb looked toward the whiteboard, then wrote, "Don't apologize only to me. Change it." Denise nodded. "We will." The hospital opened a formal review before Caleb left intensive care. Every room in the trauma unit received communication boards, yes and no cards, and tactile alphabets. Staff could no longer remove a patient's communication device for convenience. Progressive voice loss after neck trauma required renewed vascular and neurological evaluation. Behavior labeled as PTSD or non-compliance had to include the events that occurred immediately before the reaction. The changes would not restore the days Caleb spent unheard. They might prevent the next silent patient from disappearing inside the same assumptions. 3 days after the procedure, Caleb could hold the marker again. Tessa sat beside him while Samira examined the tracheostomy and confirmed that the swelling in his neck was decreasing. The breathing tube would remain for now. His voice could not yet be tested. When Samira finished, Caleb pulled the whiteboard closer. His hand trembled, and the letters leaned unevenly across the surface. Tessa waited without helping. He wrote, "You saved my airway twice." Recovery did not return Caleb Rourke's voice all at once. It returned everything around it first. The swelling in his neck decreased over the next 10 days. The covered stent remained open. The pseudoaneurysm stopped filling, and no new clots appeared on follow-up scans. His left hand regained enough strength to hold the whiteboard without support. His leg improved more slowly, forcing him to relearn balance with a therapist beside him and a cane under his right hand. The tracheostomy remained in place. Caleb could breathe and cough through it, but he could not produce the voice he remembered. Every morning, Samira Qureshi examined his vocal cords. The right cord showed only the smallest tremor. The left, weakened years earlier, still failed to reach the center. "The pressure on the nerve is gone," Samira explained. "That does not mean the nerve wakes immediately. It may recover over weeks or months. It may recover only partly." Caleb wrote, "Or not at all." Samira nodded, "Or not at all." Tessa stood beside him as he added, "You always give the worst answer last." "It is still an answer," Samira said. Caleb looked toward Tessa. She tapped his wrist twice, paused, then tapped once. He returned the final tap with his index finger. The old rhythm had become less necessary as his strength returned, but neither of them stopped using it. 3 weeks after the procedure, the tracheostomy tube was downsized. A speaking valve was placed over the opening for a supervised trial. Samira warned Caleb that sound might not come. He sat upright in rehabilitation with Tessa, Samira, and speech therapist Lauren Chase around him. The whiteboard rested within reach. "Take a slow breath," Lauren said. "Do not force it." Caleb inhaled. Only air escaped. He tried again. A faint vibration appeared beneath the breath, rough and unstable. Caleb reached for the board. Was that a voice? Tessa smiled. It was the beginning of one. The next attempt produced a sound closer to a whisper than a word. The one after that became a broken vowel. Caleb practiced until sweat appeared along his hairline, and the muscles of his neck began to ache. Lauren ended the session before he wanted to stop. Fatigue can make the cords work worse. Caleb wrote, "I have done harder things." Tessa shook her head. "That does not mean you do this badly." The first complete word came 12 days later. Tessa entered and announced herself as she always did. "It is Tessa. I am at the door." Caleb turned toward her. The speaking valve had been in place for 5 minutes. He lifted one hand and forced air upward. "Tess." The sound was low, scraped raw and incomplete. She stopped walking. Caleb tried again. "Tessa." It was not the voice he had carried into Glass River. It was not strong enough to command a team or cut through rotor noise, but it belonged to him. Tessa crossed the room slowly. "You said my name." He nodded and wrote, "Don't make it a ceremony." She laughed once. Too late. His recovery continued in uneven steps. The tracheostomy was removed after the airway remained stable through several capped trials. The opening closed gradually, leaving a second scar near the one Tessa had created years earlier. Caleb's speech improved from breathy sounds to short phrases. His voice stayed low and rough. Long conversations exhausted him. He could not shout, and sometimes the sound disappeared completely near the end of the day. He learned to pause instead of forcing it. He kept the whiteboard nearby, not because he had failed to recover, but because communication was no longer something he intended to surrender to anyone else. The hospital's review produced changes that reached beyond Room 6. Every trauma bay received a communication kit containing whiteboards, symbol cards, alphabet boards, and tactile letters. Staff training required them to place a communication method in a nonverbal patient's hands before asking complex questions. Removing a board without consent became a reportable safety violation. Denise Carver led the first session. She stood before 30 nurses and described the moment she had called Caleb a problem. "I thought he was refusing care," she said. "He was refusing to be examined without understanding what was happening. I thought the board made treatment slower." The board was the only reason anyone understood that he was having strokes. No one treated her confession as redemption. That was not why she gave it. She gave it because the next patient deserved a better first hour. Malcolm Reed revised the trauma protocol for progressive voice loss after neck injury. Hoarseness that worsened after extubation could no longer be closed as routine airway trauma without renewed neurological and vascular evaluation. Notes labeling a patient aggressive or non-compliant had to describe what occurred immediately before the behavior. Tessa remained in the trauma unit. She was no longer called the rookie with the impossible patient. Staff began asking for her when a patient could not speak, could not hear, or could not tolerate being touched. She developed a communication course using the same principles that had kept men alive in smoke and darkness. Warn before contact, establish a signal, confirm understanding, and never mistake silence for absence. Colonel Marcus Vale returned 6 months after Caleb's procedure. He found Tessa in an empty training room and placed a cloth patch on the table. A kestrel in flight was embroidered against a dark field. Tessa touched it. I thought these were destroyed. Some records survive longer than people expect. I am not going back to operations. I did not come to recruit you. Vale placed a folder beside the patch. The Army wanted Tessa to train combat medics in nonverbal casualty communication and emergency airway care. No deployments. Only instruction. You teach them what Glass River taught you, Vale said. For years, I thought it taught me that one medic eventually chooses who dies. Carter made his own choice. You carried out the one he gave you. Tessa signed the training agreement. Caleb returned to Patriot Ridge 9 months after the night he wrote Kestrel on the whiteboard. He walked into the trauma unit without a cane. His left hand had regained most of its strength, though 2 fingers remained slower than the others. He carried no board. Tessa was reviewing a chart when Denise appeared at the nurse's station. You have a visitor. Caleb stood near room 6. The swelling was gone. The scars remained. His voice would never be mistaken for the one he had before the blast. Tessa approached him. You know you could have called. He answered in a low, rough voice. Wanted to see if they still give difficult patients to rookies. Denise heard him from the station. Not anymore. Caleb looked at Tessa's left hand. Then he tapped her wrist twice, paused, and tapped once. She answered with the same pattern. He took a breath. The words came slowly, but they came without a board, a marker, or anyone else deciding what he meant. I know who you are. Tessa looked at the man he had become, and the woman she had finally stopped running from. So do I. Later that afternoon, a patient arrived after cervical surgery at another hospital. He could not produce sound, and his family had been told anxiety might be preventing him from speaking. Before anyone asked a single question, Denise placed a whiteboard in his hands. The man wrote that swallowing had become harder every day. No one took the board away. For months, silence had hidden the danger. In the end, the message Caleb wrote was what finally made the hospital listen.